My name is Colleen Murray, and I'm the owner-operator of Victor's Crown Christian Counseling Center. Today I'll be talking to you about videotaping, and this discussion is geared towards the mental health provider. Have you ever self-reported? Have you ever called a hotline on yourself and asked them to investigate you? I know, why would you do that? Well, you would only do that if you were completely confident that any accusation would be found unsubstantiated. On June 28th, the favored parent reported to me that her daughter reported to her 2 days prior that the targeted parent molested her in my office during a session after I had stepped out of the session to talk to another client. As a therapist, I knew full well this crime did not occur. And I had complete confidence that I could handle the confrontation without any concern of losing my license. Why? Because I secure authorization to record all sessions, and this session, like all the others before, was fully recorded. There are 3 reasons to record. 1, it provides objective insight. 2, it guides the follow-up. And 3, it provides documentation. First, it provides objective insight. High conflict custody cases are filled with allegations of parental misconduct. The therapists are often asked or attempt to ascertain what the child's rejection of the parent is based on. Is the child's rejection based on the behaviors of the favored parent or on the behaviors of the targeted parent, or both? The complexity of these kinds of cases cannot be handled with intuition. You need objective insight, the kind of objective insight that only videotaping can provide. 2, it guides the follow-up. Unequaled by any other method, videotaping provides the therapist with a clear perspective of how the intervention is impacting the client. Let's face it, high conflict custody cases keep clinicians on their toes in a session. And since words define meaning of a client's life, being able to review a session provides the clinician the opportunity to watch and listen over and over again to see how the client describes their life's meaning and to spot the faulty concepts. All the while identifying the implicit cues, such as the strained tones, the body language, the hand gestures, or the physical posture, the leaning forward, the pulling back, all of which can be used as a baseline for setting therapeutic goals for future sessions. And finally, documentation, or as I like to call it, corroborated proof. Recording serves as a silent witness and decreases the likelihood of the therapist's work being discredited or disregarded. First, it decreases the documentation error rates. Look, capturing every word in a session can be extremely difficult. Therapists can't transcribe as fast as people talk. And can you imagine one of these high conflict custody cases saying, "I'm sorry, I didn't get that. Could you say that again?" And second, recording decreases memory error. Lawyers can use our summarized notes against us because we are not remembering the exact details of what happened. Therefore, should we get subpoenaed, say, 2 years after the case starts, it would be difficult to come across as a credible witness. And you wouldn't be able to feel like you could validate with any certainty what exactly happened and in what sequence. For example, the lawyer might question, "So, on February 3rd, did the father say he was, or did he say he did?" And if you didn't take meticulous notes, you may not be able to answer that question definitively. And this could put the rest of your testimony at risk of being questioned or for subjectivity or then minimized. And third, it presents documented proof of how therapist has progressed. There is no subjectivity in recordings. The recordings simply record the events as they occur. And this provides objective confirmation of the therapist's analysis. Recording does not violate ethics, and it does require a little bit more work, but it's okay. Because you know what? It gives more than it takes. Recording can give you profound confidence. Remember at the beginning of the story where I was discussing the young girl? Well, because I videotaped, I was able to show unequivocally that I never left the counseling room, and the targeted parent was never in physical contact with the child. And instead of getting the therapy stalled or off track due to this false allegation, the favored parent could be and was held accountable. The court immediately transferred custody to the targeted parent until the favored parent completed individual therapy. And as you can see, recording protected the parent-child relationship. Recording helped the favored parent get the emotional help they needed. And reporting gives me confidence in these high-conflict, high-stake cases, and it can give you confidence as well. Thank you for your time today, and I'll see you in the next video.